Hi, I'm Chris Calkins, Executive Director of the online MHA program here at Penn State. I want to thank you for considering the healthcare business concentration. I want to share a little bit about the concentration and try to anticipate and answer some questions you may have about what the concentration includes and what you might gain from participating. So first and foremost, why consider the healthcare business concentration? Let me give you three reasons. Number one, healthcare accounts for 1/6 of the US economy. In 2017, the GDP of the United States was $19.4 trillion. 3.5 trillion of that was healthcare related spending. So if you're looking for a market that's not likely to shrink anytime soon and has lots of opportunity in it, healthcare is it. Number two, demographics. So you're all familiar, I think, with the terms baby boom generation and millennials and Gen Xers, et cetera. Well, the truth is there are 325 million people in the United States, and every single one of them is going to need healthcare at some point in their life. They won't all have equal access, economic or physical access, but all of them will need healthcare at some point. And third is really the opportunity to make a difference in the life of each of those 325 million people. Because everybody needs healthcare, all of them will engage with our provider system at some point. Here's the thing, unlike any other commodity or business market in the world, nobody wants to use our services. Nobody wants to need healthcare, but they're all going to need to figure out a way to navigate the healthcare system. And we train people to not only organize those systems to maximize outcomes of care, but also to facilitate people's navigation through a health episode, whether it's acute or chronic over time. Our program values are integrity, empathy, leadership, and innovation. All of our faculty have worked in healthcare organizations as clinicians, as leaders, as administrators, and we all bring that lived experience into the classroom. I think it's one of the key things that differentiates our program. Combined together with that experience is really the program value of empathy. That really means the world to us, and it's something that infuses itself throughout our curriculum. So what is the curriculum for the healthcare business concentration? It starts with a course called HPA 520, Introduction to the U.S. Healthcare System. And really our goal in that course is to help you understand who are the stakeholders in the U.S. healthcare system, how do they interact with each other, and how does that impact when and how people have access to care and what that looks like. The second course is HPA 545, Health Economics. This is really designed to help you understand health insurance markets, and the presence of insurance in healthcare really skews the way both demand and supply play out in the healthcare system. So this course is really designed to help you understand how do economic incentives and disincentives drive behavior in healthcare and health delivery. The third course is HPA 835, Healthcare Finance. We use a case study method in that course to help you understand how healthcare is financed in the US. It is unlike any other health system on the planet, for one, and it doesn't necessarily follow the normal rules of accounting and finance. It's not like we're doing anything illegal, but healthcare finance and healthcare pricing especially is unique. And so this course is designed to help you understand the kind of vagaries of healthcare finance in the US. Finally, the language of healthcare is likened to a foreign language with a lot of dialects within it. So one of the things that we will ask each of you in the healthcare business concentration to do is to complete a professional development activity on clinical terminology to help you have a grounding in the language of medicine and the language of healthcare. You can start that at any point in the concentration. Really, the point is you need to complete it by the end of completing the concentration courses. You don't need to complete it even in a single semester, but you need to complete it before we approve you to move and complete the concentration. So at the end of the day, I think really the opportunity is to work in a field where you can have daily impact on the lives of others, and you can bring your business skills to bear to improve the health and improve the organization and delivery of healthcare in the United States. It's complex, it's complicated, but it's also a worthwhile endeavor and incredibly rewarding. It's not for the faint of heart, frankly. Our field is emotionally, physically, spiritually demanding, but it's also the most rewarding thing I can think to do. It has made all the difference in the world to me in my career, and I would love to welcome you and answer any questions you might have about the concentration going forward. Thanks for taking the time to listen to this today.